Bismillah ar-Rahman Rahim. Assalamu alaikum. Dear colleagues, we have completed a discussion on 6 case histories from clinical practice of chronic hepatitis B. And as I said in the last video, that now we shall see the overview of these points or aspects of the guidelines which we discussed in these case histories. So in the next 2 or 3 sittings, what we will see the hepatitis B, its managements, and the pertinent features of the guidelines in a simplified form, and it will help us to apply these guidelines into everyday clinical practice of ours. And I hope that by the end of this series, we shall be able to treat our patients of hepatitis B in a proper way and in a way it is important and it is required. Bismillah ar-Rahman Rahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Dear colleagues, we already know we are in the interactive workshops on the managements of hepatitis B, translating guidelines into everyday clinical practice. And what do you expect? This is very important. That what should we expect from these workshops? What we discussed the 6 case histories. What was that? Of course, we should be clear about the aims of this workshop, the goals of these workshops, and objectives of this workshop. The aim of this workshop is, of course, to prevent development of cirrhosis and its complications, which is because of hepatitis B. So when a patient comes to us with hepatitis B, so our ultimate aim is to prevent development of cirrhosis and its complications. What should be the goal to get this aim? The goal is we should be able to know when to start a treatment of chronic hepatitis B patients, when to stop treatment of chronic hepatitis B patients. We shall be able to achieve the goal of preventing development of cirrhosis and its complications when we know when our goals are when to start treatment and when to stop treatment. So to achieve that aim with the 2 goals in our mind, when to start treatment and when to stop treatment, objectives of these interactive workshops are to know something about the HBV life cycle and its clinical implications, to be aware of the natural course of hepatitis B and phases of chronic hepatitis B, to know the HBV serological patterns, of course, to know the workup prior to treatment and role of HBe antigen, and of course, the treatment indications and treatment options, dose and durations, and the monitoring of treatment of these patients, and of course, to know about the response to treatment. So these are the objectives, and with the help of these objectives, we can get the goal of when to start treatment, when to stop treatment, and ultimate aim is to prevent the development of cirrhosis and its complications. So this was a case-based discussion. We already discussed 6 case histories. We know that there may be 2 clinical scenarios. The patient may present with recent onset jaundice or just found to be HBs antigen positive on screening. If the patient presents to us with recent onset jaundice, it may be because of viral etiology, hepatitis A, B, C, D, or E, or it may be non-viral like salmonella hepatitis, drug-induced liver injury, or metabolic. And of course, our first aim will be if these patients who presented to us with recent jaundice is because of hepatitis B or not. If a patient has presented to us with just found to be HBs antigen positive on screening, of course, the first question is whether the patient is acute or chronic. Of course, mostly this is chronic, because if this is acute, then the patient should have presented with the recent onset jaundice. Then this is second important point, that we should be knowing whether the serum ALT is normal or raised, because normal ALT level, it takes the patient to one track, and raised ALT level, it takes the patient to another track. Patient HBs antigen positive with normal ALT, this is either HBe antigen positive infection or HBe antigen negative infection. But if patient HBs antigen positive and the patient is chronic and the ALT is raised, of course, this is either HBe antigen positive hepatitis or HBe antigen negative hepatitis. And of course, the ultrasound is very, very important. It tells us what is the liver status, whether the liver is normal or cirrhotic, and of course, the virological profile, whether the patient is HBe antigen positive or negative, and whether the patient has got infection or hepatitis. This is the outcome of hepatitis B infection by age. When the infection is acquired at birth or early childhood, then the chances of the patients becoming chronic is high, as compared to when the infection is acquired at the adult age, then the chances of the chronic infection are very low. There is a Z model of chronic hepatitis B, and I believe that you must be knowing something about the Z model. What is the Z model of the chronic hepatitis B? One is the HBe antigen status, and in whether the patient is HBe infection or not. In the first phase, the patient has got HBe antigen positive infection. Then in the second, the patient has got HBe antigen positive hepatitis. And then it becomes again the third stage, HBe antigen negative infection. In the fourth stage, then becomes HBe antigen positive, HBe antigen negative hepatitis. So this is the Z model at the four stages of the chronic hepatitis B: HBe antigen positive infection, then HBe antigen positive hepatitis, then HBe antigen negative infection, and then HBe antigen negative hepatitis. A few basic concepts about the hepatitis B. It is the HBV life cycle and its clinical implications. We shall discuss this in the coming video briefly, that what is the HBV life cycle and what are its clinical implications. Dear colleagues, keeping in view the aims, the goals and objectives in our mind of this interactive workshop, in the next episode, we shall discuss the HBV virology and virological aspects and its clinical significance, because this is important when you decide about the treating a patient with hepatitis B. You must be aware, and you must know that in which phase the patient is there, because as I told you, in the Z model, if a patient presents to you with HBe antigen positive infection stage, most of the cases we don't treat. But when the patient has presented with the HBe antigen positive hepatitis, that is a stage when we treat these patients. But when in the third stage, the patient presents with HBe antigen negative infection, again, this is a stage where we don't treat. But if the patient has presented to us with HBe antigen negative in hepatitis stage, then again, this is the one where we treat. How these happen, what is their significance, what is their serological patterns, we shall discuss this in the coming videos. So, meet you and see you in the next video. Till then, take care. Khuda Hafiz.